Just because you have kidney disease doesn't mean kidney failure is in your future. I'm going to tell you what you can do to lower your risk of getting kidney failure coming right up. Hello, kidney warriors. James here, your favorite kidney health coach. And we're going to talk about decreasing your risk of making it to stage 5 kidney disease. Yeah, just because you're at stage 1, 2, 3, or 4 doesn't mean your future includes stage 5. We're going to talk about what you can do to help increase your chances of never ever seeing stage 5, never ever seeing a dialysis machine, and never ever needing a transplant. Now, before we get to that, if you haven't subscribed yet, subscribe to my YouTube channel, youtube.com/Dadvice TV, and click the little bell icon. That way you'll get a notification every time I upload a new video. And now, today's topic, improving your odds of never making it to stage 5. All right, the first thing you need to do is to learn about chronic kidney disease. And the best place to learn, no, not the internet, but I appreciate you guys being here learning from me. The internet is full of so much conflicting information and so much information that the people just post out there and repeat without looking up the data, without looking at the research, without finding out what is the source. Your best source for learning about chronic kidney disease is going to be your nephrologist, your kidney doctor, your dietitian, and maybe even your primary care physician. They're going to be able to tell you all about chronic kidney disease. You just got to ask, push them, ask for more questions. When they give you advice like eat a better diet, eat healthier, ask them 2 questions. And they may come across a little bit as confrontational at first, but let the doctor know, no, I don't mean to be confrontational. I want to know, why should I eat better? Why should I drink more water? Why should I watch my sodium? Let them explain it to you. Then ask, how? How do I eat better? How do I drink more water? How do I watch my sodium? And they will be more than happy to tell you. And by knowing that you're interested, they know they've got your buy-in and that you're going to follow those directions. You're going to follow their recommendations, and you have a much better chance of slowing down, halting, or even reversing your loss of kidney function. Now remember, there's no cure for kidney disease, but there's a lot you can do to regain function or at least hold it. And you can hold it for the rest of your life. All right? Also, you may have a unique situation that caused your kidney disease and caused the kidney damage. They can explain that to you and tell you all about that unique situation so that you better understand it and you're better informed. Next, you need to manage your blood sugar and your blood pressure. And this is whether you have diabetes or not. If you have diabetes, managing your blood sugar is extremely important. You're already at risk of greater kidney damage because of your diabetes. Number 1 cause of new cases of kidney disease. But if you don't have diabetes, you're still at risk. You still need to watch the amount of sugar, the amount of carbs that you eat. I would recommend, doing a reduced carb diet just to better manage your blood sugar and give your kidneys the best chance of lasting the rest of your life without excess stress, and excess workload and damage to them. And then your blood pressure, the numbers you're looking for, 130/80 or better. I know some of you are thinking, no, it's 140/90. That's for people with perfectly good and healthy kidneys. You have kidney disease. 130/80 is your max blood pressure that you're looking for. And do whatever you need, whatever your doctor recommends, diet, medication, to manage your blood sugar and your blood pressure. Last, you need to manage your chronic kidney disease. Now I know that's a giant blanket statement and that gives you absolutely no information on what to do, but I'm going to go into the details of it right now. This is the most important and the most difficult part of protecting your kidneys and keeping yourself at whatever stage you are, or even improving you and moving up through the stages. Now, some of you may be new to my channel and you may say, hey, this guy James, what the heck's he talking about? My doctor said I'm stage 4 and I can't get any better. That's bull crap, okay? I was diagnosed 5 months ago at stage 5. I was told I need to go on dialysis. Otherwise, in 45 days, my wife would be picking out a casket for me, okay? It's now 5 months later. I'm stage 3, okay? I moved up through it. And it's not that I had minor kidney damage. I was in a car accident November 12th, 2017, when a distracted driver ran an intersection in her Ford vehicle at full speed, 45 miles an hour, and slammed right behind my door. Kids, my niece, grandfather in the car, severe back damage for me. And I went through therapy and took ibuprofen. Yeah, you think it's safe because you can buy it at Walgreens. Took ibuprofen as needed, just 200 milligram tablets, 1-2 a day as needed for back pain as I was going through therapy and getting better, and I destroyed my kidneys. I didn't even know I was doing it until I had heart problems and other serious problems, could barely stand, couldn't walk more than just a couple steps, couldn't keep anything down, went to the ER, was admitted into the ICU, where I heard that phrase that we've all heard, you have chronic kidney disease. And I was told I had no hope of getting better. But I did these things that we're going to talk about, and I got better. And you can too. All right, so this next part is you got to make lifestyle changes. Now, instantly. That's what got me from stage 5 to stage 3 so far. I'm targeting stage 2. Don't know if I'll make it, but I'm going to try. If it's possible, I'm doing it. You have to make lifestyle changes. These include adding in some exercise, 30 minutes, 5 days a week. You got to get that. Doesn't need to be hard, doesn't need to be strenuous. Could be walking, could be gardening, could be out throwing the ball with the dog and playing with the kids. You got a trampoline? Hop on it, have some fun, okay? Just get your heart pumping a little bit faster for 30 minutes, 5 days a week. You gotta change your diet. You gotta eat a kidney-friendly diet. And more than that, it needs to be a low inflammation, kidney-friendly diet. So, you're cutting out soy. Most people have a sensitivity to soy and it causes inflammation. If you're one of those people, you cut it out. If you are lucky, and you don't have that sensitivity to soy, you can add it in there. For those with sensitivity, you got to be really careful. Try to avoid it or greatly limit it. Now, as far as this diet goes, you may need to talk to a dietitian. You probably need to talk to a dietitian, not Meg. You need to talk to a dietitian and have them give you a custom diet specific to your blood work. And every single time you get your labs done, you modify your diet, or you see if it needs modified. This is extremely important. In the beginning, my labs were done twice a week. Then I got down to weekly, and after every report, whatever I was too high or too low on, if I was not right there in the middle of the right spot you're supposed to be, there's a range. If I was not right in the middle, I wanted to know why. Ask the doctor, ask the dietitian. Why am I not in the middle? It's because you're eating too much of this or eating too much of that. How do I eat less? What do I need to do so that my next blood work, I don't care if it's 2 days from now, 1 week from now, 1 month, what do I need to do exactly to have it right in the middle of the standard range? I want it all perfect. So work with your doctor, work with your dietitian, and get yourself a diet and ask questions. Push them so that you know exactly what to do every single time you get your labs to get them perfect. You're not going to get everything. Your blood's going to take a long time to get normal. Your creatinine, well, you've got kidney disease, so it's going to be high for almost all of us out there. But work with them with these lifestyle changes, especially to your diet. Also, there may be some medications that you can take that can help you. Now, I'm not talking about a magic pill that cures kidney disease. That doesn't exist. But if you've got high blood pressure, there's medications you can take to help manage your high blood pressure. You need to take those pills. Don't be skipping a day. Use an app if you have to. I use one called Round. It makes it really great to remind me which pills I got to take and when, because I take multiple pills different times throughout the day. But take whatever medication your doctor has prescribed you to help slow the decline of your loss of kidney function. Next, I can't believe I have to say this, but I run into this all the time with people who are in message boards with kidney disease, still smoking. Yeah, you gotta stop smoking. If you smoke, stop. I know it's not easy, but we're talking about your life. Your goal with kidney disease is slow it down, stop it, or reverse it as much as possible so that you're not tied to a machine the rest of your life. You're not waiting for a transplant. You're not forced to have to take anti-rejection drugs the rest of your life. I feel confident that there will be a cure, a solution in my lifetime for chronic kidney disease, because it is an epidemic worldwide and so many doctors are working on it. It's costing so much money to just treat with dialysis. And dialysis is not a treatment. It's a solution to keep you alive until you can get a kidney transplant. So I feel confident a solution will be created in our lifetime, or my lifetime. So you gotta make the effort to stop smoking. That will add so many years to your kidneys and help you hang on with good kidney health until a cure is found. And this one's a tricky one right here. You need to avoid conditions or exposures that can harm your kidneys or cause your kidney function to suddenly get worse. What am I talking about? Well, first of all, there's certain medicines. An over-the-counter painkiller is very popular called ibuprofen. Oh my goodness. That stuff should be prescription. It should not be sold in 300 pill bottles where you can go in there and take. As a matter of fact, guess what? I found some data that said that you can take 10 ibuprofen pills a year without a risk of causing kidney damage. Once you pop that 11th pill, you're putting yourself at risk. Now, 11 pills of ibuprofen in 1 year is not going to ruin your kidneys, but you're increasing your chances. If you got high blood pressure, you got your diabetes, you got other issues, why even risk it? So watch out for medications like ibuprofen, naproxen, those ones right there. Don't take them. Ask your doctor what you can take. He or she is most likely, and I'm not prescribing this, but they're most likely going to say, take Tylenol, just take it when necessary and take as little as possible because it could harm your liver. Also, some antibiotics can cause kidney damage. So you want to be really careful. If you're getting antibiotics, ask your doctor, is this safe for my kidneys? Also, when you do get a prescription, you want to ask that you're getting the renal dose. Verify that you're getting the renal dose. This is the dosage of medication for kidney patients where the benefits outweigh any risk or side effects that there are. Now, most of the time, your pharmacist is going to know that this is a renal dose. You can even double check it right there when you're getting your prescription from the pharmacist. Also be careful with proton pump inhibitors used to reduce stomach acid, acid reflux. There's a lot of them that are used and those not good for your kidneys. Herbal supplements. Now, I'm a big fan of certain herbal supplements. There are certain ones that can target specific issues, such as too much water. Yeah, there's certain ones out there that are diuretics. But no matter what, whether you're taking those ones or you're taking those voodoo pills that people are selling saying they cure kidney disease, tip, they don't, They could be dangerous. You gotta talk to your doctor about even herbal medicine. Just because you can go into Whole Foods and buy it right there without a prescription does not mean it's safe. But feel free to ask your doctor, what do you think about taking this? What do you think about taking that? There are some supplements that are very helpful, and there are some herbal supplements that can be helpful for specific situations. There's specific things that certain ones can help you with, and if that's a problem, they may be a solution for you, but always ask your doctor and be careful on those. Next, there's certain dyes, they're called contrast agents, that are used to make your blood vessels in your body and your organs stand out better on x-rays and other imaging tests. Those are extremely difficult. For a healthy patient, those get filtered out by the kidneys. For us with decreased kidney function, they don't get filtered, and they can cause inflammation and all sorts of other problems of our kidneys, plummeting your kidney function and just making things worse. So if you're ever getting any kind of thing you're drinking, or if they're somehow getting it into your body called a contrast agent for some kind of imaging, ask them. Make sure they know, I have kidney disease, and ask, is this safe? If they're like, I'm not sure, don't do it until you know for sure. You need to, we're trying to hold on to your kidney function and not get to stage 5. This one right here is a tough one to actually do, but you need to be careful not to get any kidney infections. Now, the most common way is getting a bladder infection, and then you gotta pee and you're holding it. Then you put your kidneys at risk of that infection spreading. So, be careful to not get a bladder infection. If you think you do, go to the doctor right away so that they can take care of that before it gets around to damaging your kidneys. And the very last thing, check with your doctor about other things to avoid that are specific to you. Yeah, there's no one out there, no person that hasn't met you, that doesn't know your medical history, that can tell you everything you need to know that's specific to you. Your doctor can tell you, hey, you have this sensitivity, so chances are you need to also avoid this because it can cause inflammation, which then plummets your kidneys function and just moves you along that path towards stage 5. We're trying to avoid that. You can do it. I've done it. It wasn't super easy, but it really wasn't that hard. I had a great motivation. I want to see my kids get older and grow up and stuff, and I want to stay around, and I don't want to be forced to go visit a dialysis machine multiple times a week. All right, everybody. So hopefully you found this helpful. You can learn more at dadvicetv.com, my website. All sorts of great information on there, including some downloadable guides. There is a great food list that will help you find the right foods to eat that are low inflammation and great for your kidney diet. Use it as a guide. Buy the items that are on there. Stock your kitchen with those. Get rid of the stuff that doesn't work on your kidney diet. And then when it's time to make a meal or make dinner, just pick from what you got and cook it all up. And it just makes life so much easier to be surrounded by all foods that you can eat. Also, if you have any questions, post them below or reach out to me on Facebook, facebook.com/DadviceTV. And if you know anybody that could benefit from this, please share with them. Send the video to them. Post it to your Facebook page so that other people can learn and be inspired to fight kidney disease. Going from stage 1 to stage 5, it's not the only option. You do not have to always make it to stage 5. Now, there's going to be some situations where you're going to make it to stage 5. Some people just have to go on dialysis. Some people have to get a transplant, but not everybody with following these tips that I just gave, you can slow down, you can halt, you can reverse kidney damage in so many situations. So please give it a try. It's worth it. All right, thanks for watching. I'll see you in the next video.